Good evening. I'm Laura Kokocinski, the CEO with the Northwest Local Health Integration Network. I would like to welcome you to the Northwest LHIN Open House and to the third annual Leadership Award session. So this year, we were thrilled to have received a record number of applicants. The growth of the Northwest LHIN Leadership Award has made it that much more difficult for the Northwest LHIN Board to select finalists. But it also reaffirms the exceptional work that's being done in the region and the people and the programs that have gone above and beyond to display leadership excellence. In addition to leadership excellence, the Northwest LHIN gives honorable mention to the commendable work of those who are leading transformational change in the healthcare system. For the past 12 years, health service providers in our region have been unwavering in their commitment to provide high-quality care to the residents of Northwestern Ontario, in the face of both challenging circumstances and tremendous opportunities. And for this, we thank you.
Good evening, everyone, and welcome to the third annual Leadership Awards for the Northwest Local Health Integration Network. I am the chair of the board, and my name is Gil Labine. The Leadership Award is an opportunity for the Northwest LHIN Board of Directors to showcase the achievements of and show our gratitude to the individuals, teams, and organizations on the ground who strive to make sure people have access to the best care possible now and in the future.
My name is Carolyn Fanti, and I'm the director of the Regional Orthopaedic Program. I'm a physiotherapist by training with advanced practice physiotherapy background. The Regional Orthopaedic Program is the first ministry-mandated program to demonstrate true regional integration, and we've been able to do that through the advanced technology that we've brought to the region through the PROMISE platform, and PROMISE is an acronym that stands for Procedure Management Information System. With this technology, we've been able to create a centralized intake and assessment center, as well as an electronic dashboard for all patients awaiting surgery. So anywhere across the region, whoever's involved in booking patients for a consultation with a specialist, either for purely consultative purposes or for surgery, we are all looking at the same dashboard and are able to provide patients with a timely appointment based on their priority score and how long they've been waiting. And this has really met the mandate of providing equity across the region, that no matter where you live in Northwestern Ontario, that you're receiving the same access as anybody else. With this program and providing patients the opportunity to have care close to home, there's lots of cost avoidance that's of benefit to the patient, but also to the system as payor. And we are able to demonstrate to the ministry that through this visionary style of service delivery, that we could save them about $1.2 million per year in unnecessary travel grant costs incurred by patients having to travel very long distances for very short appointments in Thunder Bay.
So my name is Dave Pascas. I'm an orthopedic surgeon at Thunder Bay Regional Health Sciences Centre and the chair of orthopedic surgery for the Northern Ontario School of Medicine. Within Thunder Bay Regional, we have developed a process of pooling patients such that consents for very commonly provided procedures are pooled so that patients have the opportunity to have the first available surgeon. That's been extended also into the region, and just recently we were in Dryden, did 12 joint replacements there on Monday and Tuesday, and of those I had only met prior to the surgical day 5 of them. So 7 patients had the opportunity to have been seen by somebody else at a convenient time for them, scheduled for the correct operative time for them. That gives the primary care provider an excellent flexibility in terms of being able to have their patients treated locally at home.
I'm Dr. Michael Scott. I'm the Chief of Critical Care here at Thunder Bay Regional Health Sciences Centre and also the Critical Care LHIN Lead for the Northwest LHIN. The Regional Critical Care Response Program, or RCCR as we call it, is an innovative e-health strategy that leverages the Ontario Telemedicine Network, or OTN, to facilitate video conferencing for real-time assessment and real-time treatment of critical care patients who are in our region. It connects 11 of the Northwest Community and Emerge departments, as well as their intensive care units, to our critical care trained nurses, physicians, and respiratory therapists, as well as other specialists, and allows them to get care in real time in their own hospitals 24/7, 365 days a year.
My name is Edie Hart. I'm the clinical lead for the Regional Critical Care Response Program out of Thunder Bay Regional Health Sciences Centre. The RCCR program's goals and objectives are to improve patient safety, provide equity of care throughout the region. If a patient is in Marathon, they'll be receiving the exact same intensivist-led and directed critical care services that they would be receiving in Thunder Bay. To coordinate the Orange physician with the regional physician and the intensivist together, they collaborate and come up with a coordinated care plan for each patient.
My name is Jill Marcella, and I'm the coordinator of the Northwest LHIN Regional Palliative Care Program. The program was launched in 2015 with St. Joseph Care Group as the lead organization. So we are a LHIN-funded program, but we do engage with the region, and we are a regional program. Really work with our partners, local partners and our regional partners, in identifying system gaps, system strengths, and how to better coordinate and integrate palliative care services across settings of care and across our geography. We use a community capacity development approach when we engage with the region, where we identify what those communities' strengths are, where their gaps are, and what their priorities are. And I think this is a unique approach that we use in our region, so that we're coming in working with the community and not telling communities what it is that they need, but that they're able to tell us what their needs and priorities are, and then as a regional program how we can support those. We're not a direct service delivery program, but we do provide advice and recommendations on the types of supports and services that would be needed to better integrate and coordinate palliative care services.
I'm Kathleen Lynch. I'm the Vice President of Rehabilitative Care and Chronic Disease Management at St. Joseph's Care Group, and we are the regional sponsor of the Regional Palliative Care Program, and we've nominated the program for the Exceptional Engagement Award. When we received the notice that the LHIN was looking for nominations, I immediately thought of the Regional Palliative Care Program, because I'm so amazed at all the great work they do, engaging the region, ensuring that people's voices are heard, and the goal that everybody has in their community, the services available to have a positive end-of-life experience is something we really value here at St. Joseph's Care Group and really support through the program. And I think that the other thing we thought of about the program and this award is just the engagement with our First Nation partners, because we all desire to improve services, but the program really does look at things uniquely, and I think Jill has put it very well in terms of what can we learn from others, and what can we learn from our First Nation partners and our regional communities about what they're doing with often very few resources, and how they work together to bring people together, to support people and support them in their end-of-life journey. So I think the program really facilitates that we learn from them too as providers and spread that knowledge and create capacity throughout the regions.
I'm Petranik. I'm the President and CEO at the Dryden Regional Health Centre. I was born and raised in Dryden, and actually was born in the hospital where I work, so I think that's kind of neat. I've been working there for about 26 years. Well, if distinguished means I've been around for a long time and I'm getting old, then I think I probably qualify for that. But no, all joking aside, I think over my career, I've a very long career in healthcare in Dryden and in Northwestern Ontario. I've had the great privilege of working with so many people in our community, our staff, our medical staff, and colleagues from around the region on making a better healthcare system for the people that we serve. I'm just inspired every day by the work that people do in the system to make it better, and I think that's been, you know, a highlight of my working career. We have so many talented and smart individuals working in the system. I think our job is to try to make things easier for them to innovate, to come up with new ideas, and to put those ideas into action. Because I think the success of our healthcare system will not be based on more money. That's never going to save our health system. It's about innovation and ideas. And I think at Dryden Regional Health Centre, being in a leadership position for a very long time, we've had that opportunity to develop a culture that supports that kind of innovation. And I think that's translated into a consistent high performance for our organization over many years. Also very proud of the fact that we've been able to build a very integrated system in Dryden, so not only hospital services, but we provide community mental health and addictions programs and primary care as well. We're one of the first family health teams in the province to be governed by a hospital, so I think that's kind of unique as well. Because I think, you know, individual recognition is nice, but nobody accomplishes anything by themselves. So obviously it takes a team, and I've been so privileged to work with such a great team in Dryden that support the work that we do there. I think we've had many successes, but even more important, we've had a lot of failures. And if you're not failing, you're not trying, right? So I think that we've created that culture and that environment where people are able to try new things and able to fail and learn from those failures as well as successes. But we've had many successes and great achievements together at Dryden.